Hello again guys, this is Ryan Marshall here, Australian podiatrist working at East Coast Podiatry, Singapore. Today we're going to be discussing another running related injury and something that I'm treating on a daily basis. Now this injury is an overuse injury and something that we call Achilles Tendonitis. Now the first thing that we need to address is what is the Achilles tendon and then what is Achilles tendonitis. Now the Achilles tendon is connective tissue that runs from your heel bone into your calf muscles. The function of the Achilles tendon is to dorsiflex your foot and helps with propulsion. In activities that cause overuse of the Achilles tendon, then results in micro tearing, inflammation and pain of this structure. Weight and gender are all factors that can contribute to Achilles tendonitis. Now what we need to look at as well is the cause of the activity levels that the patients are doing. Now activities that involve springing off the forefoot, stair climbing or running activities all can increase the patient's risk of developing Achilles tendonitis due to the overload on the Achilles tendon. Now most patients, when they experience Achilles tendonitis for the first time, will experience some mild discomfort in the back of the heel after their running activities. Now in more severe cases, patients will then experience pain the next morning. Now what they'll usually experience as well is some stiffness and discomfort upon palpation, which will either be at the heel bone or in the mid-insertion of the Achilles tendon. Now what we have to understand about the Achilles tendon is that it is a very avascular structure, meaning that there is not much blood flow to the area. The most common area of injury for the Achilles tendon is within the mid portion because this has the least amount of blood flow. Therefore, if a patient has injured the area and they are not addressing the cause, then they are at a very high risk of further injury. Now what we have to look into are what are the treatment options for Achilles tendonitis. When we look at the treatment options for Achilles tendonitis, we have to address the cause and then also treating the effect. Now when we treat the cause, we have to look at the patient's activity levels first and then of course provide in-depth information regarding activity modification. Now this may mean reducing the running activity and performing more swimming activities to reduce the load on the Achilles tendon. The other factors are that we need to address is also strengthening exercises and stretching exercises. Now, if we strengthen the Achilles tendon and the calf muscles, then they are at reduced risk of tearing because they are a stronger structure. Now, the big factor that we need to address is the patient's foot posture. If a patient has abnormal foot posture, then they are at risk of injury, meaning if their arch is too flat or too high, then pressure is not equally distributed. What we need to do is put the foot in a more ideal position to reduce this repetitive overuse. Now the way that we do that is through the use of prescription customized foot orthotics. The goal of treatment is to put the foot in a correct position to stop that overuse of injury. Patients need to understand that orthotic devices won't interfere with their activities or their lifestyle. More so, they will complement and reduce the risk of injury. Now that we've addressed the cause, we then need to address the effect of injury, which is the pain, the inflammation, and the tearing of the Achilles tendon. What we specialize in is the use of extracorporeal shockwave therapy, or ESWT. The benefits of ESWT is that it's used from outside the body. Risks of surgery are reduced. Now the role of ESWT is to do what we call increasing the neovascularization. That means increasing the blood flow to the area to then increase healing enhancement at a much quicker rate. What it also does is it increases collagen synthesis, meaning that it strengthens the structure of the Achilles tendon and reduces the risk of recurrence of injury. Now both the prescription of customized foot orthotics and the use of extracorporeal shockwave therapy will be used in conjunction with in-depth information regarding patient activity levels, patient footwear, and strengthening and stretching. Now, if you're serious about your activities and you have been experiencing any discomfort or you do think that you're at increased risk of injury, I would advise you to consult with a podiatrist to see what can be done for you today. Thank you guys very much for tuning in, and I look forward to speaking to you soon.
For more information on related conditions, check out our other videos.